Flat foot deformity is a deformity in which patients lose the arch of the foot, and basically there is a rollover of the foot and they're walking on the inside part of the foot. It can be from driven at the ankle level, it can be at the mid part of your foot. The main symptoms of flat foot are majority of the patients, it could be idiopathic, and 20% of the population has it normal and they don't have any symptoms. But as they grow into it over a period of time, they might develop symptoms of pain. Predominantly, initially the pain may be on the inside of the foot, and as it progresses, they might start developing pain over the outer aspect just below your ankle. They might have pain, and if there is, depending on the cause, if there is a rupture of the tendon or insufficiency of a tendon, then they might get pain along the, again, inner aspect of the foot and ankle. And they start struggling to tiptoe, basically getting over the tiptoes, and struggle with the push-off. The main causes of flat foot are 20% of the population, they're born with it, it's idiopathic. But it could be related to fracture, especially the mid part of your foot fractures. It could be associated with inflammatory conditions such as rheumatoid arthritis. And and the most common cause that we see in a population over 60 is with insufficiency of a tendon which is on the inside of your ankle called tibialis posterior. And there is a ligament which supports the arch of the foot, incompetence of that ligament called spring ligament. Depending on the symptoms, we try to manage this without surgery. That would include support to the arch, physiotherapy to strengthen, and sometimes some injections do help to help with your pain and get rid of your symptoms. But these are transient. The surgical options are performing a minimal invasive heel shift osteotomy and reconstruction of the tendon when it is a flexible deformity. What I mean by flexible is the joints are still mobile, but if it's left for a long time and if it's gone past a certain stage where it becomes stiff and arthritic, then the options would be corrective osteotomies and fusion of the joint. The surgery is, again, typically recommended when you have failed conservative options, which we have briefly mentioned about. And the surgery, if we are reconstructing, entails you having a reconstruction of your tendon called tibialis posterior, which is on the inside of your ankle, and we'll use the tendon which moves your toes to do the function of tibialis posterior. And sometimes I do use some braces to support the ligament and perform some minimal invasive heel shift osteotomies. And overall, you will be in a plaster. Patients will be in a plaster for about good 4 to 6 weeks for everything to settle down, and then loads of physiotherapy and weight bearing. Similarly, if we fuse the joint, it's pretty similar in terms of not putting weight and mobilizing, and it could be done both arthroscopic and open procedures as well.